Hello everybody. Let me share some insights into breast cancer. The lifetime risk of an Indian woman developing a breast cancer is 3 to 4%, which is much less compared to her American counterpart, almost 13 to 14%. But what is disturbing is survival in the Indian woman, only 60 to 70%, as compared to 90% and more in America. And the major reason is they pick up breast cancer much early. What are the risks that you have of developing a cancer? Age is one. So as you age beyond 50, your chances increase. A family history, which is very, very important. Multiple family men having breast cancer, especially early, before the age of 50, could be a clue that you are at greater risk. And these could be due to faulty genetics. Faulty genetics here would also mean you should report the increased incidence of cancers in men, because many of these faulty genes predispose to cancers both in women and in men. And particularly in women, you should report both breast cancer and ovarian cancer. What are the symptoms that you have? A lump in the breast. So you have a nodularity, a kind of stiffness, something which is uneven when you examine your breasts. An abnormal nipple discharge or some abnormality of the nipple and changes in the skin of the breast. This is best done by following a method of self-examination of breasts. It is recommended to do it so that at least you pick it up at the earliest abnormality, and I have shared a link where you can see how to do self-examination of the breast. Let us look at the survival by the stages of breast cancer. Stage 1, it's almost 99%. But stage 1 means a size of tumor less than 2 centimeters, just like a peanut. It may not be possible to pick it up by self-examination. As we move to stage 2, it's 90%. That is less than 5 centimeters in size. So the peanut is now like a walnut. You should be able to pick it up by self-examination at least at this stage. Stage 3 is 70% and stage 4 is dismal. Only 20 to 30% survival. So the key is picking it up early. And how do we do that? Self-examination. Yes, even clinical examination is emphasized. But what we need is a screening test to pick it up early. And the most popular, the one which has greatest data, is mammography by the X-ray technique. You also have mammograms done by ultrasound and by MRI. Your doctor will let you know when those are needed. And screening is one thing which can pick up the breast cancer much early. The only problem is it picks up a lot of things, which is what is known as false positive, 10 to 15%. So your mammogram actually tells you the probability of a cancer. It does not diagnose cancer. Now, which has to be diagnosed by a tissue biopsy. 10 to 50% of the time it might tell you something is wrong, but something may not be wrong. This is the major problem. But you should be ready for it because you still want your cancers to be picked up early. It also picks up cancer so early that a new stage is there, stage 0 in breast cancer. Most of it is because of the pickups by a mammogram. Here the cancer has just started. It's not even stage 1 and you have picked up here. You will be advised to remove your breast to decrease the chances. Some people argue that this stage 0 may never progress. Okay, that might be fine. But still we know that we need to pick up the breast cancer early to improve survival, and America gives you the best data. They pick up about 20% of the patients in the stage 0, something which is also known as ductal carcinoma in situ, DCIS. So if you want to go mammogram, at least you should know what is stage 0 and what implications it has on you. Because of this false positivity, earlier we screened women at 50 years and above. But 10% of all breast cancers occur below the age of 50. So some people thought if we start at 50 and above, we might miss a lot of patients. So they came down to 40 years of age. So different societies will give you different recommendation. 40 years, 45 years, 50 years. I say if you have family history of cancer, start early. Until what age should we continue? 70 to 75 years. As life expectancy is increasing, we are raising the bar a little bit. But beyond this, probably there would not be much benefit by doing a screening examination. And how often it should be done? Well, every 1 to 2 years. That the doctor will guide you depending on your risks and the findings on a mammogram, how frequently should you do. What about genetics? 10% or even more of all breast cancers are related to faulty genes, which can be identified. And 90% of this is contributed by this gene BRCA1 and 2. If you want to know an example, BRCA1 was what Angelina Jolie carried, which meant she had a 50 to 80% chance of developing breast cancer in a lifetime. And you know what she did? She removed both her breast tissues, underwent bilateral mastectomy to decrease this risk significantly. Someone has taken that step. At least you can start by a screening mammogram. And when should you consider a genetic testing? Societies give you differing opinions. Somebody say if you have it below the age of 40, some say 45, and some say even below 50 years of age. So if multiple family members have breast cancer, you might be a candidate to get a genetic test done for yourself and find out if you're carrying a defective mutation, and find out what are your odds of survival so that you can take your decisions. I have tried to give you just an overview. You can learn more from here. If you are someone above age of 40, make your decisions based on this little knowledge. If you're someone who knows someone above age of 40 years, help them to take a decision. I have done my bit. Now it's your turn.